Hello everyone, and welcome to this audio podcast. This audio podcast as part of as part of a Corpuscle Quake edition. This audio podcast as part of a Corpuscle Quake edition. This audio podcast as part of a Quake and Storm. This audio podcast as part of a Bostics Quake, and this audio podcast as part of a Storm Robotics production. So in around the sort of conclusions and sort of summary, if you like, around this peer review works from 2015. So with POCT, or point of care testing, and disease prevention becoming increasingly important, scientists and community pharmacists can now play a sort of active play an active role, or have an active basis. There are various costs. There are varying costs to consider. For example, human resource. For example, human resource point of care testing kits, clinical auditing, external quality assessment, and quality control checks. But point of care testing, POCT, and collaborative referral service between primary care service providers would be more cost effective than renal replacement therapy, or RRT. Retrospectively, there has been only a single investigation that explores POCT in amongst community pharmacies, and so there is a lack of evidence, or sort of broad evidence to identify how POCT would prove cost effective. And more immediately required are cost benefit analyses or studies. But initially, POCT in suspect or high risk patient is likely to be viable, feasible, cost effective, and beneficial to patients. In other parts of the world, scientists and community pharmacists have more clinical roles. Collaborative screening, and prescribing and referral services between scientists and community pharmacists and general practitioners would enhance patient access to care and access to care and regimens and around drug regimens and management. With new healthcare initiatives on the horizon, many community pharmacies are equipped with sophisticated record access IT systems and interfaces to monitor drug interactions in suspect or high risk CKD recipients or patients. Interfaces at the same time can be utilized further, allowing scientists or encouraging or allowing scientists and community pharmacists to have more clinical involvement based on community need. Ultimately, POCT collaborations to screen a suspect and high risk CKD recipients or patients in situations other than the traditional general practitioner or GP environment would allow broader service availability amongst primary care. That draws this audio podcast to a close. This audio podcast as part of a Corpuscle Quake edition. This audio podcast as part of a Quake and Storm. This audio podcast as part of a Bostics Quake, and this audio podcast as part of a Storm Robotics production. In this audio podcast series, there will be a list of citations or references that listeners can refer to as part to identify similar works around this peer-reviewed works, and around this audio podcast edition. Thank you.